Well, good morning, everybody, and I'd like to thank GS1 for inviting me to come along and talk to you today. As Ben said, I'm from the MHRA, and I've already been asked a couple of times what is the MHRA today. So just to remind you all, it's the Medicines and Healthcare's Products Regulatory Agency, and we're responsible for safety and fitness for purpose of medicines, medical devices, blood and blood products. What I'm going to do today is focus mainly upon medical devices, which is my area of expertise. But much of what I say would generically be equally applicable to medicines and other areas of procurement as well. The talk that I'm giving after a few initial slides, the first main chunk of it focuses on things to do with the supply chain and manufacturing, and then the latter part is to do with patient safety and the NHS. And I gather there's about an even split between people from companies and people from the NHS here. So I'm hoping there'll be a little something for each of you. You may also wish to be familiar with the other bits which aren't within your immediate areas of responsibility. So the key message really that I've got this morning is summarised very rapidly in the first two slides, and it is that GS1 is not just about the supply chain, although that's clearly a key element of what's happening. It's also about matters relating to patient safety, and that's crucially important. A lot of people still nowadays seem to think that barcoding and the implementation of GS1 is entirely to do with procurement and internal supply chain, but it's not. There's increasing drive to use GS1 codings in other areas as well, and patient safety is key to that. So what I'm going to do is, in the next few minutes, is just highlight some of the patient safety aspects of the NHS eProcurement strategy, and you've already heard about some of that from John Warrington. Talk about the relationship between GS1 and unique device identification, because I still think there's quite a lot of misunderstanding about all that. Very quick mention of UDI databases, which would be increasingly important, particularly for manufacturers, but I think they'll also have important use for healthcare providers as well in future. And then using GS1 or UDI in patient records and what we'll do with that information at the end of the day. So I've already heard about the eProcurement strategy, which was now published about 14 or 15 months ago. And that says a number of things about patient safety, which I think are really important. First of all, it says that the procurement strategy drives patient safety benefits. So it's not just about procurement, it's about patient safety as well. It also goes on to suggest that barcodes based on GS1 standards should be able to be read at any point in the supply chain. So that's right through from the manufacturer, right through till the device ends up with the patient, so that products subject to a safety alert can quickly be located and recalled. And that's vitally important. And there have been a number of unfortunate experiences over recent years where we haven't been able to do that, and it's a key part of patient safety that we should be able to do that in future. And it also goes on to suggest that providers of NHS-funded healthcare, and not only NHS hospitals, but anyone who supplies NHS healthcare nowadays, must be able to electronically track and trace individual medicines and medical devices to a specific patient. So you get this tracking all the way down the line, so you know who's been exposed to what particular device, if there are any problems for the future. And then we've got unique device identification. And I'm sure some of you have heard about this. Some of you have sort of heard the phrase, not really sure what it's about. But it's an important concept which is becoming important on a worldwide basis now for patient safety issues. And it's already been implemented in the US, but we're doing the same kind of things in Europe. And the current European regulations, which have been being negotiated for about 5 or 6 years now, talk about UDI. And they suggest that a unique identification system based on an international guidance, and we can talk about international standards such as GS1 as an important element of that, should be able to significantly enhance post-market safety of medical devices. And here's a list of some of the things they do. Improve incident reporting, better targeting of recalls, better monitoring by competent authorities such as the MHRA, reducing medical errors. We've already heard about the concerns that the Secretary of State's had over wrong hips on wrong sides, etc. Fighting against counterfeits, in the past, counterfeits has only really been much of an issue in the medicines area, but it's becoming an increasingly big problem in the medical devices area as well. And UDI has a potential significant benefit as far as that's concerned. And then, of course, as an afterthought, improving purchasing and stock management by hospitals, a very significant part of this activity as well. So how does all this fit together? What is the relationship between GS1 and UDI? And I think the simple way to look at this is once the GS1-based procurement system is introduced in the NHS in England, GS1 and UDI will essentially become synonymous in those areas, not anonymous. So there still won't be, GS1 still won't be the only UDI system which is legally usable in the European Union once these regulations have come in. But for NHS hospitals in England, it will be essentially the same thing. So when you're implementing your eProcurement strategy and your GS1, you're de facto implementing the unique device identification requirements. And GS1's identified this for a number of years. Obviously, they're an organisation who's always on the ball, and they produced a guidance document a couple of years ago which says quite clearly the GS1 system of standards supports all stakeholders to meet UDI requirements by enabling interoperability and compatibility. And that's a very important thing because it's not, all of this stuff is not just about systems within one part of the healthcare provision. It's about getting a chain of interoperability all the way through from the manufacturer to the patient. And that will work both within borders, between organisations, purchases and healthcare providers, and exchanging information between healthcare providers and across borders. And it plays a very significant role from the perspective as me, who works in the regulatory authority for exchanging information with other European and international competent authorities on the safety and quality of medical devices. And a single standard can ultimately accelerate the implementation and increase compliance with UDI regulations. So even though we don't actually have the European regulations in place yet for UDI, by working towards implementation of GS1, we're putting ourselves ahead of the game so that when that comes in, those who are already ahead of the game on GS1 should essentially be there as far as UDI is concerned. I don't expect people to look at this slide in detail, but it's something I lifted out of a GS1 guidance document, which yet again gives you a cross-correlation between the requirements for UDI and what the GS1 standards delivered, with the key thing being the GTIN, which I'm sure all of you in this room are well familiar with by now, being essentially exactly the same as the device identifier, which is the key piece of information in any UDI database. And a number of manufacturers have been doing this already for quite a few years. I've been using this slide for a couple of years now, and it's so old that the product which it was taken from has gone out of date. You can see it was actually expired in February 2015, so I hope if anyone's got those, they've taken them off the shelves by now. But you can see across the top, we've got the conventional information which manufacturers supply, product codings, lot numbers, expiry dates, and then across the middle, you've got your concatenated barcoding, which has got your GTIN on it as the device identifier, and then information about production, expiry dates, lot numbers, etc. And quite a few manufacturers have been doing this for quite a few years. They're already there. They're already supplying hospitals with information which is essentially UDI compliant, or will be compliant with the UDI regulations when they come in the future. And this is just a quick overview of what the UDI system looks like, and you can see there are three key elements. On the left-hand side, manufacturers have to give a product a unique identification. They have to apply some kind of machine-readable data on there, whether that be a linear barcode, a 2D data matrix, or an RFID. And then most importantly, the most important bit of it is the bit in the middle, the UDI database, which will be really what drives things along in terms of sharing information in the future. As I said, the FDA have already implemented UDI systems. Their regulations came in September 2013, and for the highest risk devices, they've already been putting UDIs on their databases since September. That information is now publicly available, so you can begin to look at what a UDI database looks like by going onto the FDA website, and they will be continuing to implement UDI between now and 2019 on a risk basis, so the highest risk devices first and the lower risk ones later. And we're following suit in Europe. As I said, there are new regulations coming out on UDI in Europe. They'll supersede existing regulations for medical devices, and they include an article on UDIs. Implementation may be in 2017, but we're actually expecting to see the European regulations published in a near final format, hopefully within the next couple of months. So I don't want to go into much detail on this slide, but you can see what I'm trying to do here is to point out that the comparability between the electronic catalogue, which John Warrington talked about, the NHS database using the GDSN system, and the UDI databases. So if manufacturers put their GS1 information into the GDSN, that will automatically be fed into the UDI databases in the US, in Europe, and in Japan, and into the hospital databases as well. And there will be electronic systems for automatically doing that, which are already working in the States, and we're expecting to see parallel systems implemented as the European system comes online in the next few years. So on then to what's happening in hospitals. We already had Ben just mentioned briefly about the patient identity bands. Mine I don't think is fully GS1 compliant at the moment, and I must get a decent slide which actually has the picture on that. But as you can see, from October 2013, all identity bands in the NHS have to carry a GS1 data matrix, which has got this key information to identify the patient, NHS number, first and last name, and date of birth. So that gives us a way of uniquely identifying the patient. And the concept, as I see it, is that we need to tie together this information with the other information on patient electronic records, bring the UDI together on all of this at the point when the patient is exposed to the device, when they receive the implant, or they undergo the procedure in the cath lab or whatever. You then put this electronic information into a centralized system, perhaps using hospital episode statistics, or more likely some other more modern systems such as care data, and then we can analyze that system on a centralized basis via the clinical practice research data link to give us information about tracking implants to patients and post-market safety surveillance. And this is the same thing in pictures, really. You can see the patient bracelet there, you can see the person scanning their product there, and recalling PIP breast implants and metal on metal hips, which is some of the kinds of issues, patient safety issues, which we've been challenged with in recent years. So what else will UDI be used for once we've achieved all this? Well, there's a whole range of things, really. As I said, it will be used for reporting adverse incidents to European regulatory bodies. In the UK, that's MHRA, and that's going to be a legal requirement it's already a legal requirement on manufacturers, but there's increasing onus and pressure on the NHS to report problems as well, so that we can get maximum information about the safety and quality of medical devices. Recalls and safety warnings we've already talked about. Exchanging information about counterfeits, yet again, as I said, I think that's going to become increasingly important as the years go on, and counterfeiting, unfortunately, becomes a more common activity for medical devices. And then all the stuff about exchanging information. Regulatory bodies in different areas, both Europe and abroad, need to exchange information with each other. We need to have information exchange with implant registries, which are becoming increasingly important for tracking down registries, and we need to have ways of exchanging information between implant registries and regulators in the future as well. So all of this is enabled and facilitated by having unique device identification, which is based on GS1 codes and similar. So in summary then, GS1 is not just about procurement, it's also about patient safety. That's the key thing. If you don't remember anything about this other than the fact that I haven't worn an orange tie, then just recall that one. Once GS1-based procurement is introduced throughout the NHS, in effect, GS1 and UDI will become synonymous with each other. Information in GS1 data pools can be fed into UDI databases, so that should, if we can get it, if the regulators can get it right, be coordinated so you can put the same information in once and it'll go into US databases, European databases, and databases in other areas. UDI or GS1 incorporating patient electronic records will facilitate post-market safety monitoring and implant and patient tracking and tracing. And UDI helps communication. So just to sum up then, if you've come here from a manufacturer today and you're involved in the procurement side of things, when you go back, go and talk to your people who are in the regulatory department and say to them, this is not just about procurement, this is also about regulatory compliance, because you'll then get them listening and on your side straight away. And if you work in the health service and you're in the procurement section of the health service, which I think a lot of people are today, go and talk to the clinicians, because to make all the kinds of systems that I've talked about work, the key buy-in is going to be from the clinicians. And I think that if we can get clinicians and regulatory people and everyone working on this, then we'll have a joined-up system which will have a much better benefit on patient safety. That's about all I've got to say, so I gather that I've got the responsibility for handing over to Rachel.